Hey, it's Mr. Shrum, and we are going to finish up the respiratory system unit today. And we're going to look at issues. It's always fun to look at what can go horribly, horribly wrong with our body. So here we go. The respiratory issues interfere with the body's ability to receive an adequate supply of oxygen. They can range from mild to severe and vary in how preventable and treatable they are. And we're going to look at pneumonia, COPD, which stands for chronic obstructive pulmonary disease, and sleep apnea. Pneumonia is an infection where the air sacs in the lungs fill up with fluids. Bacteria, viruses, or fungi can cause pneumonia. I had pneumonia when I was really little, and it was not fun at all. And I experienced many of these symptoms. So depending on how severe the case and how old the person is, these symptoms can occur. And it's kind of like the flu. So fever, sweating, chills, cough accompanied by phlegm and or pain, fatigue, muscle aches, headaches, shortness of breath, nausea, vomiting, or diarrhea, low body temperatures, or sudden mental changes in elderly patients. So I was pretty young, so I didn't have um, these so much. But I definitely had shortness of breath. Like it just felt really hard to breathe. What are some of the risk factors? Being an infant and toddler or elderly person, long-lasting diseases like heart disease or asthma, a weakened immune system, smoking, being on a ventilator in the hospital. So, yikes. Well, how do you treat pneumonia? We have some medications that can help, such as antibiotics, antivirals, fever reducers, cough suppressants. And how do you prevent this altogether? Well, vaccines for flu and pneumonia can, of course, prevent that. Proper hygiene, hand washing, covering your mouth when coughing, staying home when sick, that can prevent bacteria and viruses, fungi from getting you sick. Healthy lifestyle choices for nutrition, sleep, and exercise, and not smoking. Uh, yeah, just don't smoke, guys. Don't start. There's almost no positive benefits. Now, COPD, maybe you've seen commercials about this, but it stands for chronic obstructive pulmonary disease. It's a lung disease that hinders breathing by constraining airflow. And the most common conditions are emphysema, and that destroys air sacs. And chronic bronchitis causes airway inflammation. So we have emphysema here on the bottom, and then we have chronic bronchitis. Those with COPD often have periods where symptoms get worse for a while before they fade away. And common symptoms can include a persistent cough that produces fluids, so like very phlegmy coughs, shortness of breath or wheezing, a constriction in the chest, blue lips or fingernails can also occur, low energy levels if you're just really tired, if you're losing weight and you're not intending to, and recurring respiratory infections are all common symptoms. Risk factors include smoking, especially if you have asthma. So if you have asthma, don't smoke. Yeah, if you don't have asthma, don't smoke as well. It's yeah, large amounts of secondhand smoke. So if you're around people that smoke a lot, you're also more at risk for COPD. Working in an environment with dust and chemical fumes, being older than 35, and genetics, and you have no control over that. So that's awful. How do you treat COPD? Lung damage cannot be reversed, but treatments for COPD can help control symptoms. So treatment options, doctors will tell you, hey, give up smoking if you can. Medications like steroids, inhalers, or antibiotics can help. Oxygen therapy and rehab programs. Lung transplant or lung volume reduction surgery. That removes pieces of damaged tissues, damaged lung tissue. That can help with COPD. How do you prevent COPD? Never pick up smoking or quit smoking, smoke very infrequently, whatever. Using respiratory protective equipment at jobs with lots of dust and or chemical fumes. So that's another big thing. There have been improvements in occupational safety, but for a long time, people that worked in these factories or in unsafe work environments, they would get sick and get all these health issues. And, that's because the company didn't provide them with safe equipment. But yeah, it's really, really awful. Imagine having to work and pay rent and then your job gets you sick. Awful. Sleep apnea is a disorder where you repeatedly stop breathing while sleeping. Obstructive sleep apnea is caused by the throat muscles relaxing to the point that they constrict airflow. So if you have a family member with sleep apnea, they are usually noisy sleepers. Central sleep apnea is caused by the brain failing to send signals to the muscles needed for breathing. Obstructive sleep apnea is much more common than central sleep apnea. So symptoms for sleep apnea can include loud snoring, insomnia, suddenly waking up breathless because you technically were not breathing at periods in your sleep. So that's why people they may sleep all night, but during the night they are waking up and they're not getting full deep sleep because they're constantly not breathing sometimes. If you wake up with a headache or dry mouth or sore throat and difficulty paying attention, I wonder why that's a symptom. Risk factors for sleep apnea include being overweight, having a narrow airway or nasal congestion, being male over 60 years old or African American, having a family history of sleep apnea, using substances that relax throat muscles, alcohol, sedatives, etc., smoking, having heart disorders, a stroke, or a brain tumor. So some of these will just make it more likely that your throat muscles are constricted in some way. How do you treat it? Well, doctors will encourage you to lose weight, give up smoking. They may provide you with a sleeping device that can open your throat, pressurize air, or increase oxygen levels. They may, under more drastic circumstances, go for surgery to remove tissue, reposition your jaw, reduce snoring, anything like that. And then maybe treating other medical problems that are contributing to the sleep apnea. How do you prevent sleep apnea? Maintaining a healthy weight, not smoking, avoiding the use of alcohol, sedatives, and other throat relaxers. And that can all help with sleep apnea prevention. While some respiratory issues may have mild effects, others can be potentially life-threatening. Prevention measures for several respiratory issues include making healthy lifestyle choices that are in your control, like not smoking, exercising more, practicing proper hygiene, and getting enough sleep. Now, sometimes I recognize not everyone's in a great environment or they have a perfect home that they can do these things in. But sometimes a lot of this is within your control to some degree, and that's nice to know. All right, so that's the end of the respiratory system lesson walkthroughs, and I will see you next time. And if you have any questions, be sure to ask me, message me, and I will help you with anything. And until next time, have a great day and rest of your week, and I will see you all later. Bye-bye.